4 weeks from today is New Year's Day. It's also the day when more than 500,000 Ohioans will see their health insurance premium skyrocket, because that is when the COVID-era tax credits provided to those covered under the Affordable Care Act expire.
As News 5's John Kosick tells us, lawmakers on both sides of the aisle in D.C. are looking at options to help, and it'll become a major issue in next year's midterm elections.
Former Senator Sherrod Brown knows the impact of wave elections. He won a seat in the Senate and won in 2006, and he's hoping to do so again 20 years later. The issue then was the war in Iraq. The issue next year is shaping up to be health care.
You're going to hear stories in here that are horrendous.
Brown holding a roundtable discussion in Cleveland this day with those impacted by rising health care costs related to the expiration of tax credits at the end of the month. What he heard mirroring stories from across the state.
I was talking to a business owner, one-person operation in Columbus, and his insurance will, he said, at least double his rates, and he'll go without insurance. And that's not good for anybody. It also raises rates for others.
As Americans struggled with COVID in 2021, Congress passed the American Rescue Plan that included in it what were called enhanced premium tax credits. And what they essentially did was make insurance premiums more affordable for those covered under the Affordable Care Act, Obamacare. Well, those credits were extended the next year in the Inflation Reduction Act of 2022, but they are now set to expire at the end of the month. And that's something the nonpartisan Kaiser Family Foundation estimates will cause the average premium to more than double. The Senate will likely vote next week on a Democratic proposal to extend the benefits, but that would need some Republican votes to pass. Ohio Senator Bernie Moreno and John Husted both telling me they support an extension, but contingent upon reforms.
We have to restore income caps. I don't think people who make $400,000, $500,000, $600,000 a year should get subsidies from the federal government. Number two is eliminate $0 premiums.
That is, require everyone to pay something towards their premiums. And third, he said, would be providing that subsidy, those tax credits, not to the insurance companies, but directly into the accounts of the consumer, almost like an HSA, something Senator Husted supports as well.
The insurance companies are making a ton of money at the expense of the taxpayer and the American consumer. And instead of sending the money to the insurance companies, send it to the individuals. That way they can pay for either premiums or their deductibles.
Both support a clean extension of the benefits, though, until those terms can be worked out. Congress has 2 weeks left to strike a deal before breaking for the holidays. In Cleveland, John Kosick, News 5.